Hundreds of new COVID-19 cases are flooding hospitals in Greater Taipei. Level 3 restrictions are now extended through June 14th, and restaurants across the nation no longer offer dine-in service.
Health Minister Chen makes an emotional appeal for people to wear masks and businesses to follow closure orders. That's after police officers were infected with the virus in the line of work.
Later in the show, Natalie Tso talks with top epidemiologist Dr. Mei-shang about the current outbreak and which vaccine she prefers.
And in Hashtag Taiwan, Leslie Liao takes a look at how the internet responded to the government's decision to adjust the daily number of COVID cases from the past 2 weeks. This is Taiwan Insider.
This is Taiwan Insider, and I'm Andrew Ryan. And as you can see today, I am all alone in the studio. But don't worry, Natalie and Leslie will be joining us a little bit later on in our program. For now, it's just me in the studio, along with our cameraman, Tom, who you can see is over there about 4 meters away from me. Now, I'm only going to have my mask off for a couple minutes, so let's get straight to it. Here's the latest. 13 more people have died of COVID-19 in Taiwan. That single-day high came on Thursday, bringing the death toll for the country to 59 since the start of the pandemic. As of Tuesday, Level 3 COVID restrictions set to expire on Friday are now extended through June 14th. Health Minister Chen says the situation is not getting worse, so there's no need to increase the restrictions. But there are concerns about hidden cases that could spread the virus to family members and beyond the home. Chen says the extended restrictions will be difficult for people and businesses, and the cabinet is working on more subsidies to help relieve the burden. The health minister was visibly emotional when talking about police officers on the front lines. He spoke directly to people flaunting the rules and putting the police at risk. People should be responsible and wear a face mask, he says. And as for those entertainment businesses that are still operating in secret, that's a burden for all of society. And police officers have gotten sick as a result. People who aren't complying should really think about what they're doing. Chen says that while Level 3 restrictions are in place, people still need to wear a face mask when leaving home, maintain social distance, and limit the size of gatherings. Now, there was some good news this past week. Health Minister Chen says that by the end of June, Taiwan will have about 2 million vaccines. And by the end of August, about 10 million, including local vaccines. But for now, some Taipei city hospitals are struggling to keep up with hundreds of new COVID-19 patients coming in every day.
Taiwan's worst COVID-19 outbreak to date has hit Taipei City fast and hard. According to the Taipei City Hospital Labor Union, the reality is medical resources are maxed out. The union says staff and supplies are stretched thin across all of the city's hospitals. They're warning that collapse is imminent. All hands are on deck to combat COVID-19. Medical staff regularly work 12-hour shifts, with one worker saying they took only one sip of water in a 7-hour span. The influx of COVID patients means that hospital beds and respirators are also hard to come by. Union head Guo Kuei-ying says that some city hospitals have resorted to placing COVID patients on tables. She says that medical staff have to make the difficult decision of which patients can get medical attention. Guo says it would be better if overwhelmed city hospitals could temporarily stop taking in COVID patients. Taipei city hospitals have begun limiting non-urgent care services in order to shift the focus to treating coronavirus patients. But it takes time to reallocate resources and train personnel. Taipei City Hospital Superintendent Huang Sen-jian says that the hospital is working to dedicate wards to treating COVID-19 patients. He says only medical workers that are willing to work with COVID patients will be sent to the front lines.
So what can we all do to help reduce the burden on hospitals? Well, for one thing, only go to a hospital for a COVID test if you really need one. So who needs a COVID test? That's the subject of today's Taiwan Explained. In normal times, you might not worry about a cough or a bad case of the runs. But in an outbreak of COVID-19, it's easy to panic. The question is, should you get tested? Doctors say you should pay close attention if you've come in contact with a patient, traveled to a high-risk area, received a phone alert, or have symptoms. Those symptoms include things like a fever, cough, or diarrhea. But they say not everyone should get a test. This doctor says if you've stayed away from hotspots with lots of infections, you don't necessarily need a rapid test. The most common symptoms reported by people at testing sites are a fever, sore throat, cough, and diarrhea. If you've been to a high-risk area but don't have symptoms, you should quarantine at home. Dr. Lin recommends a separate room for family members in quarantine. Officials say that right now, Taiwan's medical system can handle the outbreak, but the best thing you can do to help stop the spread? Stay at home. Up next in our show, Natalie talks with one of Taiwan's top epidemiologists.
Andrew and I are social distancing today, so I'm in this cool part of the station. If you can guess where I am, leave a comment below. But this is where I just had a video interview with one of Taiwan's top epidemiologists, Dr. Mei-shang. She is also a professor of biomedical sciences at Taiwan's leading research institute, the Academia Sinica. Now, Taiwan has seen hundreds of daily cases of COVID-19 since May 15th. I asked Dr. He what those numbers signify.
It probably signifies that during the previous days, like the days before May the 15th, before we were very much aware of what was going on, probably we were very relaxing and there were lots of what I would call super spreading scenario or super spreading event. In such case, it would be lots of party, lots of interaction with people from all directions, and they have lots of physical contact. They were singing, dancing, etc. And these were all very sort of the situation scenario very conducive for explosive outbreak. All the cases we are seeing now, because we are now about 10 days down, since the sort of level 3 alert, and I believe most of what we are seeing were resulted from May 15th, before May 15th. So of course we have to continue to follow. After May 15th, what is the situation? I believe the transmission was not stopped totally, but I would say the transmission was dampened, hopefully, greatly. So if that was the case, we would see the onset symptoms occurring between May 23rd to May 28th, about these 5 days. We were seeing them continuously going down. And in order to see that, to be sure that we are not missing people who are still at home, we would have to follow the whole situation, probably 5 days onwards, say until June the 3rd or the 4th, so that we would be sure that the cases we are seeing are stable and would reflect whether our level 3 lockdown is effective, and whether we basically, and whether we are containing the situation or whether we are not.
Dr. He, how anxious are you about the current situation?
I'm not really very anxious, actually, because I'm an infectious disease doctor. We've seen a lot of this situation, and we know how to put the figures. Although I know humans are not figures, but still, when you put in a public health contact, that you have to count the numbers and to know how extensive it is. When we put the figures in the perspective, it's really not very bad. It's still relatively low compared with all these other countries over 80 years old, over 60 years old, 70 years old. The death rate, we are far from the death rate that have been reporting. So the important thing is our healthcare capacity. That's the one thing. It's going to be the bottleneck of what we can do. So we do the best to try to preserve it.
So it looks
Okay.
like Taiwan will have 3 different types of vaccines: AstraZeneca, Moderna, and our local vaccine. Can you tell us what you think of these vaccines? Will you be willing to take any of these vaccines yourself?
I would say this in a very careful manner because I know whatever I say, people follow. So
That's right. You're an expert.
It's true. This morning, 2 days I went to buy some passion fruit. And they didn't have it. Second time I asked passion fruit. The guy says, "Oh, that's something we have to eat. So thank you for telling us." Oh my God, it's just something I like. So I have to be very careful about what I say. But basically, each vaccine has its strengths and disadvantages.
Do you
So
have a preference for the type of vaccine that you would want to get?
I have to say, because I had participated in the vaccine trial, so I had been administered 2 doses of one of the 2 local vaccines.
Oh, okay.
The reason why, because they have been announcing again and again that they were there's a shortage of participants, subjects over 65 years of age. So I just gathered me and myself and with all my
You're not over
colleagues here.
65, are you?
Well, I'm over 65, so we
No,
kind of
I
help
can't
them.
believe that. You look so
We just help them
young.
to get their numbers. Basically that's the situation. Good or bad, you need to have numbers to know it's good or bad. And the earlier we know it's good or it's bad, the better off we are. So that's the situation. So with
You
no
look
presumption of whether it's good or bad, we just participate in it.
You're actually vaccinated then, right? You're
Yeah.
fully vaccinated.
We don't know, because I may be in the placebo group, but I don't think I am. Because from my reaction, I have a little local reaction. I do know another person went with me. She had no reaction at all, none.
What was your reaction?
Just on the second dose, local site with swelling, hot, hard, a little pain,
And
It's
that, how long did that
more.
last?
3 days.
3 days.
Yeah, 3
So-
days.
So
It's, I consider it's a really quite severe reaction because it's hard and red. It's hard, red, hot, just on the arm side, that the administration side. But I think it's okay. I just stopped playing tennis, or I just let it rest for a few days. Yeah.
how long do you think it will take before Taiwan can go back to normal?
Normal, I would say, until we fully vaccinated, about at least 50% of the people are vaccinated. So it would be quite some time, but hopefully we don't have to upgrade our level of alertness. Hopefully we are able to maintain what's essential and activity, and then to cut down just the leisure, the non-essential ones, we cut it out. So just tolerate a little bit, it will go away.
Are there any last words you would like to tell people in Taiwan and throughout the world as they continue to face the pandemic?
Well, I would like to say that just hang in there, keep healthy. A healthy body can prevent all diseases. So it's important. And how to keep healthy, especially now we are all staying at home, still try to keep active, doing something, push up, whatever, and eat healthy. Don't binge away with sweets. It's important. It's really important. And if necessary, take some vitamin supplements so that keep your nutritional level at optimal level, etc. These are all very important, and just stay, in a good mood, and don't worry, knowing that we will pass. We will win the battle.
I felt relieved after talking with Dr. He. If she can be so positive, I think we can too. And there's a lot we can do to keep ourselves healthy and hopefully virus-free. Now, the whole interview was very informative. It will be up on YouTube and Facebook. Next up, Hashtag Taiwan with Leslie Liao.
The phrase of the week is 校正回归. Translated literally, this means correctional return. RTI has been referring to this as adding backlog cases to previous daily totals. Basically, there's been a delay in COVID-19 testing and authorities are now going back and increasing the numbers on certain dates. The term sounds like bureaucratic hoopla, and, well, it kind of is. But there's a huge debate surrounding this term, and in fact, it was one of the most Googled terms in Taiwan this week. Since the beginning of the pandemic, Taiwan's Central Epidemic Command Center holds a daily 2 p.m. press conference where officials announce the newly confirmed COVID-19 cases from the day before. The CECC generally just goes, here are how many new cases there are today, and they announce other pandemic things. However, last Saturday, during the daily press conference, they announced 321 confirmed cases, with an additional 400 backlog cases, which were attributed to other days earlier in the week. Health officials said backlog cases happen when high COVID-19 testing volumes causes a delay in reporting. In simple terms, the testing process got jammed up and health officials couldn't get the correct numbers out in time. But a lot of people went, hold up, you can't just correct the numbers to make them sound better than they are. For example, saying 321 plus 400 sounds much better than confirming 721 confirmed cases in a day. People online started memeing the situation. The idea was, well, if the government can correct numbers, then I want to correct numbers too. This meme is an exchange between a couple. The girl asks the boy, how many girlfriends have you had? The boy says, just you, baby. And then it says, after getting married, the husband corrected that number to 50 girlfriends. Now that is something you don't want to go back and correct. Just be upfront, be truthful about it. It's easier that way. This meme says, you having lost all that weight preparing to stuff your face with all those backlog calories. Now I have definitely been adding those backlog calories back in ever since we hit level 3, you know what I'm saying? When backlog cases first surfaced, a legislator asked if paid taxes can be returned to the people, to which someone on the internet said, well, have you heard of a tax refund? Because it sounds like you might be describing a tax refund. In all seriousness though, backlogging isn't something Taiwan just pulled out of a hat. There's precedent for it from the UK, Japan, and the US. Whether or not they should distinguish between backlog and new cases, I don't really know. But for proper data processing, I do think it's important we know which cases were confirmed on what days. That way we get a much more statistically accurate picture of what's going on. If it were up to me though, I'd go back and correct this whole COVID-19 disease, in general. This thing's just done us no good. Bonus tag! On May 18th, Taiwan announced that schools had to close between May 19th and May 28th. Parents freaked out because they had to work and didn't know what to do with the kids at home. On Tuesday, official extended closures to June 14th. Now, parents in Taiwan look like this. That's all I've got for you this week, guys. Good luck, parents. You're gonna need it.
Before we leave you, a look at some of the other stories on our radar.
Taiwan has extended a nationwide Level 3 COVID alert through June 14th. That's with hundreds of new COVID cases announced every day. A Level 3 alert means that schools and public venues are closed and mask wearing is enforced outside the home. Authorities are now issuing automatic fines to people who don't comply with mask rules. That's without giving them a warning first. There are a few minor exemptions. For instance, food delivery workers can remove their mask to eat outdoors because restaurants aren't allowing customers to dine on the premises. But the general rule is no mask, no excuse. The maximum fine is 15,000 NT dollars, or $539 US. A ban on indoor dining due to COVID-19 is hitting restaurants hard. A survey of over 7,000 restaurants has found that, despite takeout services, business has fallen by an average of 70% since last month. A proposal to restore Taiwan's observer status at the annual World Health Assembly has failed to make it on the agenda this year. Taiwan's diplomatic allies submitted the proposal, but it was blocked due to Chinese opposition. This is the 5th year in a row that Taiwan has been barred from the assembly due to Chinese pressure.
And finally today, our question of the week. What have you been doing to stay positive? Let's go to Natalie first.
Scrabble. I love to play games with my kids. That makes me really happy.
Scrabble. That's a great word, Natalie. What about you, Leslie?
Well, guys, I've been sticking to a routine. Every day when I wake up, I know exactly what I'm doing. Have my coffee, have my probiotics, have a vitamin, do my exercise, and so on. Every day, I know what I'm doing because I stick to the same routine, and before you know it, the day's gone by, and what's quarantine? I don't know. I'm just going about my day.
All right, and my word of the week, 1 a.m. walks. That's right. I've been leaving the house with a face mask on, going for a little jaunt in my neighborhood. And here are some pictures that I've taken. You can see the moon is beautiful and some empty houses. And it's just a great time to be alone and kind of breathe and think about what's going on. And I find it very relaxing. Well, thank you so much for joining us for Taiwan Insider. I'm Andrew Ryan.
I'm Natalie Tso. Have a great week.
I'm Leslie Liao. Hang in there, guys. We're going to make it.
And as always, we want to remind you to connect with us on social media. Leave a comment below. We'd love to hear from you. See you next week.